Hi, everybody. Welcome back to another great Facebook Live. I'm Katie. I am with LiveLung, and we are back today with our subject matter expert, nurse navigator, Morgan. Hi, Morgan.
Hello.
Awesome. So before we get started, disclaimer, and I say this every time, I just want to remind you guys that the information shared today is for informational purposes only. So this should not be considered as medical advice. Everything that you see and hear on the internet, you should check with your own personal healthcare provider. Okay, so today we are going to talk about something that I've been dying to talk about. It is sleep and the benefits of sleep, especially for cancer patients. A lot of us know that, sleep plays some sort of role in our well-being, but we don't know exactly what or exactly how. And for people living with cancer, quality sleep really is a critical component of their healing, their treatment, their recovery, and their survivorship. So today we're going to talk to Morgan about sleep. So Morgan, tell us a little bit about the definition of sleep and what we may or may not already know about it. What is your experience with sleep, and why is it so important for us?
Okay, well, it is very important, and I didn't realize how important it was until I did some additional research for this. And I'll tell you, sleep is right up there with food as far as our health, and but more especially for our quality of life. I mean, it's a quality of life issue if you have, no medical problems, no cancer. If you can't sleep, it is a quality of life issue. But more importantly, for those people who do have cancer or other chronic conditions, it is a key component in healing. Now, as I say that, there's a disclaimer that I need to make. And excuse me, I did some research on, of course, wanting to learn more about it, maybe a little bit more scientifically. And there's a lot of information out there that put it out as, sleep can be a factor in cancer, in causing cancer. Well, of course it can. Once you take your first breath as an infant, anything can cause cancer. So, I don't want anyone to, leave this program feeling like, oh, if I had only slept better, this wouldn't have happened to me. No, that's not true at all. It's part of what, contributes to a healthy life. It does have direct physical, the quality of sleep has direct physical outcomes, but in the almost 10 years I've worked in oncology, we see all kinds of people that have cancer, people who have the utmost healthy habits, vegetarians, vegans, marathon runners, all kinds of people you would, if a healthy lifestyle was the only factor, they would never be meeting with me. They would never be coming in. So
absolutely. I will say that I don't think I ever had a problem with sleep until I was diagnosed with chronic illness. And then, of course, there are that scanxiety when you're monitoring that tumor, right? Or watching and waiting for your next treatment option. And those things really weigh on your mind. So add on to that the regular stresses of life, and then maybe some of the things that we're seeing in our world today. What are some of the things that we can do to how do you know if you just had a bad night's sleep or if you have a problem and you need to seek some help with sleep?
Well, I would say if you, from what I read, and again, we have to look at quality of sleep and we have to look at duration of sleep. Now, as adults, as adults, we need about 7 hours of sleep a night, and that's what the literature tells me. We need 7 hours. However, surprisingly, if it is a good quality sleep that one can experience, we don't need to have it all at one time. So yes,
Wow,
I
I
know
did
it's
not
really
know that.
I know. I know that I guess quality if you take a nap and in the afternoon or sometime during the day, that can contribute if it's good sleep. No, but what is good sleep? What a good sleep is, again, the most important thing is how you feel when you wake up, and how what kind of duration you get out of feeling rested. Feeling rested is the most important indicator. So, that factors into quality of sleep. And it's sleep is it's a complex thing. It was fun doing the research for this because I had lots of opinions. I have had sleep issues. I have some chronic problems, and I have sleep issues, and I just didn't realize what a vast body of knowledge there is out there. That being said, there's a large body of knowledge that people don't understand about sleep. And someone likened it, or one of the articles likened it to it's a jigsaw puzzle. We have many, many, many of the pieces, but we really don't understand how all the pieces go together.
Well, and it does go together because let's say, you're experiencing pain from your cancer or chronic pain from your condition. That impacts your ability to go and stay asleep.
Right.
And not having good sleep could intensify your pain. So there's
Right. Right.
that cycle of sleeplessness and pain. How do we break out of that? What are some of those common sleep disorders, and what can we do? How do we recognize those, and what can we do about them?
Okay. Well, the biggest sleep disorder is insomnia. And yes, you can read all kinds of information about sleep, but from what I could see, about 90% of people with a cancer diagnosis have insomnia, either ongoing insomnia or intermittent insomnia. And, a variety of things can cause that. First and foremost, sleep, and I'll get to this in a little bit. Sleep affects our immunity. It directly affects our immunity, like food and nutrition affect our immunity. So there's that biological basis to it. Plus, it's just a host of things that can cause it. So what people, can do is to recognize how often that you experience insomnia. And, and then if you do, then one needs to talk to their provider about it, or their nurse navigator who can, give them some information about how to deal with it.
Yeah.
So, that's one thing you can do, but there's just a whole host of lifestyle habits that will improve insomnia if one is, able to take them on. Like we all know that not eating before you go to bed. We know that, not having too much alcohol before you go to bed. We know that if you get exercise, you can sleep better. But medications, not just cancer medications, a variety of prescription medications and over-the-counter medications can create insomnia. So it's just this whole variety of things that you have to kind of look at and say what could be causing this.
Right.
So insomnia is the first sleep disorder, and when we're going to move by exactly some of the things that you can do for it to another sleep disorder, and that would be a sleep-wake cycle disorder. And that would be where some people would, and this would sort of would refer back to the napping, that people don't get good sleep at night, and so they nap during the day. They find themselves napping more in the day, and then they don't sleep at night, or someone gets admitted to the hospital, and God only knows who can sleep when they're admitted to the hospital. So some people are up all night by the disturbances, and then they sleep all day, and that kind of develops into a cycle. That being said, the same can happen for a shift worker. A shift worker can get their days and nights flipped around. So it is a recognized disorder, this sleep-wake disorder, circadian rhythm disorders, it's called. Another kind of sleep disorder is a sleep apnea. Now, I didn't know this not too long ago, but people think about sleep apnea as something where people stop breathing and then they don't get the air in their lungs. And so that causes them not to be able to sleep because they're not getting enough oxygen. And that's what I always thought it was. But what it actually can be more than stopping sleep, it can be if people have shallow respirations. If you breathe fast, if you have more respirations a minute, chronically have more respirations a minute than normal, if you're under stress, if you're worried, if that's causing you to, then what happens is that the air doesn't actually reach your lungs. It just reaches the top of your lungs. And so the bottom of your lungs aren't inflated. And that is considered sleep apnea. And of course, the known treatment for that, sleep apnea, both with people who stop breathing for a length of time or people who have these shallow respirations and can't expand the back of the bottoms of their lungs, is the CPAP machine. And CPAP, we all know over the years, people get these machines and then they can't use them. They are, creating better and better machines out there. But from what I understand, for some people, using that machine can cause a more restful sleep the first night they do it. So that's something that, people have to consider. Yes, it's inconvenient, or yes, I would rather not be doing this. But if it's, as I said, it's a quality of life issue, and it's actually even a physical issue. So what is important when we sleep? Sleep's divided into two different cycles, or two different kinds of sleep. And I'm just going over this so that people understand where the problems lie and what kind of sleep that you need. And everybody, or most people, are probably familiar with this. You hear of REM sleep, REM, rapid eye movement. That is cycle number one. Cycle two is divided into 3 subcycles. It's called non-REM, NREM sleep. And what happens during these cycles is they kind of follow each other. The NREM cycles usually begin with the first NREM being just muscle relaxation. Okay, you lay down, feels good, you kind of doze off, your muscles start to relax. And so that is the first cycle of NREM. The second cycle is a deeper sleep, a sleep that will produce more relaxation and more of the affecting the immune system, the actual physiological benefits of sleep. And then the third N stage is N3, which is deep sleep, which usually takes place, during later in the night. The cycles can actually go back and forth. You can go from an N2 to an N3, back to what we're going to describe as REM sleep. And the length of time that you spend in the cycles will really determine what kind of quality your sleep produces. So then there's the REM sleep, REM, it's short for rapid eye movement. And that's the period of sleep where you are relaxing, but your brain is more active. Your body's remaining, of course, relatively inactive, but your brain is more active. And that's the phase that people will dream in. And that usually can last, anywhere from 25 minutes to an hour or so. But you can cycle from REM into a stage 2 or a stage 3. And it's unknown how all of this happens. So much is unknown about dreams, but your best sleep physiologically happens in the stage 2 and the stage 3.
So talk to me a little bit about we talked about how much sleep a person needs. What about when we're in treatment? Because I remember being so fatigued and just feeling like I was in and out of sleep. One of our Lung Cancer Network members posted, I feel like I'm sleeping too much. I'm sleeping all the time when I'm not at treatment. So how does somebody know if they're sleeping too much, and if it's a good thing to sleep to heal and let our bodies heal, or if there's something else going on that they need to talk to their doctors about?
Well, it depends on the kind of treatment you're getting. Radiation treatment, big culprit of people feeling very fatigued and tired and not being able to get enough sleep. Chemotherapy, immunotherapy, I mean, they all have a big impact on the body. So if you think of that, your body needs to interact to produce these physiological responses first that will permit sleep in your body, whether you have an illness or not, then think about what it's like when somebody has a disease, a chronic disease, even if it's not cancer, or if it's something like cancer treatment or radiation treatment. So I guess what you read so often, what you encounter is exercise, exercise, exercise. That's supposed to be good for sleep. Well, I mean, that's a hard line when you are feeling really crappy and you can't get that restful sleep that your body needs. And I guess if you think you are sleeping too much, then that's something to talk to with your provider, because it is something that, again, it's a quality of life issue. And it's, again, that there may be some interventions, to help you. Sometimes people need, some stimulant kinds of medicine. Sometimes they work, sometimes they don't work. But, your body has to work hardest for sleep is when you're getting those treatments.
Yeah, absolutely. And that's a tough one, because you don't know if in the beginning, you don't know if it's the medication, if it's the treatment, if it's psychological. It's something that you really have to deduce. And I had one patient who changed everything about the way she went to sleep, not necessarily medication or anything like that, but just the pattern in which every night she would get herself ready and I guess, decompress and get ready for bed. And that was something that helped her. And it was a completely organic way to help your body go to sleep. So what are some of those ways? I mean, I know we said medication, and medication is a great thing. Better living through chemistry. If it helps you, I think it's great. If your healthcare provider recommends it, fabulous. But what about some of those things that we see on TV, like those sleeping patches, or like the little roller ball on the bottom of your foot, or all these weird as seen on TV things, or the magic pillow or something like that, right? That's supposed to help us go to sleep. The internet is full of charlatans selling all kinds of products. What are some of the things that we can do, some of the legitimate things that we can do to help us when we're trying to just grasp the elusive sleep?
Right. Well, the first thing is what you mentioned is the sleep routine. Just building a sleep routine that you do every night. That and the theory behind it is that if you do it, it builds into a habit, and you do things that are conducive to sleep and that give your body signals that you're going to sleep. Okay, so some people, maybe they need to turn off their TV an hour before they go to sleep, and if people can't do this, then eliminate that. If you feel like, oh, I really can't do that, turn off the TV, then just eliminate once you are ready to go to sleep, to build a certain ritual. whether that means, well, you're going to take a bath, or you're going to wash your face, or you're going to brush your teeth, you're going to check the doors that they're locked. It can be like a host of things that you do. And then, the hope is that as this habit builds, your body will learn to sleep. Interestingly, there's an actual course that has been developed. It's called CBT, Cognitive Behavioral Therapy hyphen Insomnia, CBTI. And that builds on, it's a course that I don't know where, I'm supposed you could get it on the internet. I didn't get that far with it. I'm going to ask the palliative care people about it. But anyway, it teaches people, it does more than just build that physical ritual. It helps you deal with intrusive thoughts or anxiety or difficulty falling asleep. It deals with a host of other things in your mind, cognitive behavior, in hopes that it will improve insomnia. And does it work for everybody? No. But I just find it interesting. It supposedly works for a lot of people. So I'm going to find out more about that.
I love it. I love learning about this. I did a little experiment on my husband where I asked him to charge his phone across the room, at night, because at night he charges his phone, and instead of having it right next to the bed, he put it across the room so he couldn't touch it. Fell asleep just like that.
Wow.
There are a lot of external things that are keeping us engaged and awake, and just, that stimulation of 24-hour news and all of the things that may be happening in our world. And so it can be really tough when you're trying to deal with cancer and living life with cancer.
Right.
So tell me a little bit about the consequences of ongoing sleep disorders. If you have insomnia, or if you think you might have sleep apnea and this is an ongoing thing for you and you have not gotten help, but what are some of the negative effects of that?
Well, some of the information that I read said that it can actually it can affect your prognosis. It can affect your cancer prognosis. And the way that it does that is that the impact of your body can't overcome all the challenges of the treatment. With people being, if you're stressed and you have all these other outside things, then you go to treatment and you're bombarded with more stress, more drugs. Lots of people know this. They give you, in addition to chemotherapy, that you are given steroids a lot of times. Steroids are notorious for being sleep disruptors. And it said, I understand that it can actually impact one's response to treatment. And we'll get a little bit of scientific here. And I'm trying to break this down into its simplest terms. But again, it is an immunity kind of issue. It can disrupt when you don't get enough sleep, when you don't get enough quality restful sleep. It can disrupt your body's immunity. And the way that it does that is on two levels: a molecular level and a cellular level. Now, molecular levels is the most widespread, because it can happen to all of us when we're sleep deprived. And that means that when you are sleep deprived, the molecules, now recall from science, our science classes in school, that the smallest of all human energy is the atom. Okay, so that's the smallest, and atoms join together to form molecules. And then molecules have a variety of ways that they affect cells. Okay, so on the molecular level, when you are sleep deprived, your body secretes what's called cytokines or cytokines. And cytokines are induce inflammation in people. So even if you don't have a cancer diagnosis and you are not sleeping, your body, your immune system is being disrupted by these cytokines, which cause inflammation. And as we all know, inflammation is very key in cancer treatment, somewhat in cancer prevention, just like sleep in cancer treatment. A lot of your cancer treatment drugs will increase cytokines. So when this happens, it creates inflammation, and so that is disruptive to you, which can impact your response to treatment, your outcome. And so that would be on the molecular level. And then on the cellular level, and the second part of the science instruction for tonight is that the molecules interact with the cells. They attach to the cell wall, they enter the cells, they form proteins, they have a variety of functions that they build protein, and they build tissue, all kinds of tissue. So they actually, if you are sleep disrupted and to a portion that is going to affect you, it will affect the way your T cells, which are in your blood, fight the cancer and fight your response to the cancer. So that's a little bit scary, isn't it?
That's very scary. Wow. So this is the main reason why we wanted to talk about
right.
sleep.
And that's correct. Yes. Because there are ways of dealing with it. And, we haven't talked about, I kind of saved the, should we take drugs or not till the end, is because even though there's a drawback to the pharmaceuticals you can take for insomnia, it's probably better to have, to get that quality sleep than not.
Right. Absolutely. I remember very, one of the issues that I experience is degenerative discs in my spine, which can be very painful. And I remember not sleeping because it was so painful. And then it was just that cycle that kept going. And my healthcare provider was like, we've got to get you to sleep. And I thought, what? No, you have to fix this problem. But it was, you had to start on that foundation of sleep before you could build upon those other things that, you could take care of.
Right.
And you take care of the sleep, and then magically the pain's a little bit better.
Correct. That's absolutely correct. Plus, it gives you more energy having quality sleep. It gives you more energy to do things for yourself. We've talked about this before. How, if you're feeling pain or too much, too fatigued, you're not going to do exercises. You're not going to do them. It's just human nature. It's just, and you're not going to do the things that could help your problem.
Right. And what's really difficult is if it was not something you did before you were diagnosed, right? If you didn't have a routine before, if you didn't have sleep issues before, you could really be struggling with ways to grapple with. I've been awake, last week, I was like, I'm up at 2 a.m. I can't wait to talk about sleep. And, I know I'm supposed to put my phone across the room. I know I'm supposed to turn out the light, but it's so much more fun when, you're just doom scrolling.
Oh, it is. I mean, I'm a YouTube surfer. And nothing makes me happier than having some time at night to sit in bed and just surf YouTubes.
Right. So what I have been advised to do is to carve out time for that. Don't wait till bed to do that.
Right.
But carve out some time to do that during your day.
Right.
And that way you're not stealing from the precious hours that you need at night.
Right.
So one of the things that I think is something that we might be able to touch upon, and we don't have a medical health professional on our live today, but I just want to mention that dealing with anxiety and feelings of depression or feelings of isolation, loneliness, those types of things can impact your sleep as well.
Correct. Absolutely. Majorly.
Yes, absolutely. Those mental issues that I think all of us that have ever been diagnosed with anything face, because it's just not normal for us to be dealing with our health and our illness, that kind of thing. So, what are some of the things that someone can do who, like my husband, he closes his eyes, he's out like a light. Let's say someone like him who's been diagnosed and now, falling asleep is just not something that they can do, and they're kind of frustrated. What do you recommend for them to do at 2 a.m. when they're floundering and frustrated and tossing back and forth and not getting the sleep that they need?
Well, if you find yourself in that, situation, it's important that you talk to your provider or, seek palliative care on the issue, and go with the medications and to see where that takes you. There's a variety of medications out there. They start with, with the supplements you can get for sleep. Those the things that like you said, they advertise, the sleep patch and all these things, and over-the-counter things like Benadryl, antihistamines often promote sleep. So, you can always start with something over the counter. But again, as for someone in cancer treatment, you need to check with your provider because some of these even supplemental things can interfere. So, you can do that. As far as sleep medications go, yes, they're out there. They come in different, they affect different receptors in your brain. There's, the sleep wake cycle type of thing. There's your medications that will address anxiety and depression. The common ones are Xanax, Ativan, those, if you have to, you have to, and try it with the intention of, well, I don't want to stay in this forever, and I'll deal with it. The bad thing about them is that yes, they can like Ambien. That isn't a direct benzodiazepine, but it's kind of has this very similar action, and you can wake up feeling great on these medications. But the thing that they do is they interrupt with, remember we talked about that REM sleep earlier. They do interfere with deeper sleep.
I did not know that.
Yeah, it's discouraging.
Yeah, I did not know that. And I will say that in my personal experience, I never took anything for sleep, but the things that I took for anti-nausea or anti-anxiety or even like the Benadryl, the antihistamines, those really, when taken at night, promoted my sleep and gave me the sleep that I needed to heal. Which I think is really important. I do have to share, several months ago, we had some very sad losses in our lung cancer community. And there were several patients who, night after night were posting online, it's 3 a.m., it's 2 a.m., it's, and they started talking to each other at 2 and 3 a.m. And I think that gave them, it gave them the confidence to move forward in such a difficult time, and it let them feel like they were not alone. And so there's like the little insomnia club, and they connect at night. And if you don't have to go through it alone, don't go through it alone. definitely can contact your healthcare provider. But until then, pop online and grab one of us because chances are we'll be awake too.
Yeah, that's great advice. That's great advice. Another thing you can do, surprisingly, will induce more relaxation is simply belly breathe. If
Okay,
you
tell me a little bit
can,
about that. What is that?
this is like if you, let's say you're on your back or on your side, is to, take a deep breath, start with a slow, deep breath, and deliberately start it in your abdomen, near your diaphragm. So you're pushing your diaphragm up, and you start the air starts filling from the bottom to the top of your chest, from the bottom of your lungs to the top. And when you take in that big deep breath in that manner, you hold it for 5 seconds, and then you slowly let it go. Now, I have read that 20 of those will put you to sleep. My experience is I can't get to 20
No.
because they don't really all feel like, sometimes you just don't feel like breathing like that anymore.
That might be the trick. I'm trying it tonight. Well, I'm gonna put it to the test.
Okay. I mean, it's a great thing to try if you wake up in the middle of the night,
Yeah.
and it generally does relax you more. And then some people do that progressive relaxation where they concentrate on they start with their lower body and tell it to relax, I am relaxed, go through your body. Again, that's something that some people may not have the patience to go through your whole body and do it, but it is something you could try if you want.
Yeah, that's right. That's great. That's great. Great, great. What about external things that really mess with our sleep? Like I have 120-pound fluffy, mushy love bug of a rescue dog who happens to just lay all over me. And sometimes I wake up all cramped and just feeling like I've been smothered all night by this lovely bluff. So I mean, really, it's common sense, right? Like just make the plan, move the dog, all that.
Right, right. Try different things. I mean, sometimes that big fluffy mass on you can actually be calming.
Yeah.
I've heard that petting, like petting a dog or cat for 10 minutes can drop your blood pressure. So if it can drop your blood pressure, it can contribute to you going to sleep faster.
Ooh, I
A
like
dark room, you see
that.
that over and over and over again, is try to have your room darkened.
Oh, and
And,
temperature. Oh,
you
temperature
know,
is very important.
yeah. Some people like sound machines. Some people
Oh,
find that they call it white noise, brown noise. There's different kinds. If you go on YouTube, there's different kinds of noises, and they're supposed to produce different kinds of rest and relaxation sleep. So that's something you can try if you want
yeah.
to. If you have to sleep with that phone next to you.
Right. Oh my gosh, I have been on that phone laying down and fallen asleep and it fall onto my face. I'm
But
told I'm not the only one that's done that.
you're not. You're not. Now the other thing, I don't know. Do you remember anxiety blankets? I haven't seen
Oh, like the
them.
weighted blankets.
Pardon me.
Like the weighted
Yeah,
blanket?
a weighted blanket. Now, that sometimes that, and it can be the same thing with a pet. Sometimes if it's in the right place, that pressure on you can be relaxing. And again, you have to judge these pets because you love them. You don't want to put them in a crate, but you don't want them to, disrupt your sleep either. It's
Yeah,
hard.
make them a part of your new
That's
routine.
right. That's right. Right. That's right.
Oh,
I brought home a pillow for my one dog. She loves pillows, and so they have these
oh.
little pillows for breast cancer patients. They have these little pink polka dot pillows. I said, "Can I buy one of those?" And the navigator said to me, "Just take one."
Oh,
So we're gonna try that on.
I know, I know. I think I've tried everything, and I think What's important to note is that everybody is different, and what works for one person might not work for another. If you connect with a peer who also is having some sleep issues, maybe you guys can share and trade off and see if, you know, these little sleep products or you know, like a cooling pillow or a weight blanket, or so you don't have to invest in two, you can just invest once and see if it's something that works for you. For me, it's all about a nice long bath and clean sheets and a cool ceiling fan. So it's all about comfort, and don't think about it as a luxury. You know,
correct. That is absolutely correct. Whatever you have to do, right?
Yeah, it is a necessity, and I think that's also something in our minds, especially those of us who may have been diagnosed in the middle of our careers or busy lives. You know, we're not used to resting or sitting down, or, you know, I remember my husband, I'm a caregiver for my husband. So, you know, resting for him, he said, made him feel like he was being lazy, those kinds of things. So I just want to let folks who are watching know that sleeping while you're in treatment, while you're healing, just in general, sleeping in general is a necessity. It's like food.
It is. It's like food. It's as important as food.
Absolutely. And I think that's a great place to stop, because, you know, nobody's talking about sleep, and we'll go through the rest of the month looking for some resources, and I'll throw them out there on Facebook as well, because, you know, they're helping me too. So it'll help all of us. All of us. Absolutely. And I think it's just so important because it's something that's really universal. You know, my condition's different than yours, and there are very many different lung cancer diseases, types out there that they, you know, it's just, everybody is just so different. But what is common is that we face these kinds of things. Right.
And nearly everybody will. Right.
All right. Well, thank you so much for being here, Morgan, and talking about this. I loved learning about, you know, the biology and the molecular explanation that you gave. I feel smarter already today. And I'm not alone. I know that there are other folks out there that are dealing with sleep issues too. So we're going to keep the conversation going. We answered the questions. We actually took the questions that we had, and we worked through those today so that we can answer those. That talk to your healthcare provider if you have issues with your sleep or getting enough sleep, or if you think you're sleeping too much. And there are ways that they can help you, and you're not alone. And Morgan and I will see you next time. All right. Bye, guys.
Thanks, everybody. Bye-bye.